The reproductive technology, an overview. ART comprises a group of procedures that have in common the handling of oocyte and sperms outside of the body. The gametes or embryos are replaced into the uterine cavity to establish pregnancy. These procedures benefited many infertile couples but are stressful, very expensive, with complications such as OHSS, multiple pregnancy, abortion, and ectopic pregnancy. Definition: ART refers to any fertility treatment in which the gametes, sperm and ova, are manipulated. Accordingly, ART procedure involves surgical removal of the eggs known as egg retrieval. IVF is the most common ART procedure. It was first successful by Stepop Edwards in UK, leading to the birth of first IVF baby Louis Brown in 1978. Indications are abnormal fallopian tube, blocked tube or absent tubes, endometriosis related infertility, idiopathic or unexplained infertility, male factor infertility, immunologic infertility, failure of ovulation with donor ovum can be done. Bilateral oophorectomy for diseased ovaries. Investigations prior to ART. Semen analysis, culture and sensitivity. Complete workup including thyroid function tests, blood sugar, serum prolactin level, serum FSH on day 2 or 3 of the cycle, serum estradiol on day 2 or 3 of the cycle. Test for ovarian reserve like anti-Mullerian hormone measurement is considered the best test. It is indicated in women greater than 35 years old, smokers, presence of only one ovary and unexplained infertility. It involves standard day 3 laboratory tests as mentioned above, along with administration of 100 mg clomiphene citrate from day 5 to day 9, repeat FSH on day 10. FSH values must be the same as on day 3 of the cycle. Serological evidence of chlamydial infection, zona-free hamster oocyte penetration test to access fertilizing capacity of the sperm is optional. Enhanced sperm penetration test using test yolk buffer. Testing both partners for anti-sperm antibody. Assess uterine cavity by hysteroscopy or transvaginal sonography. Hydrosalpinx reduces IVF success rate by 50%. Success rates to expected rates after surgical tying of excision or hydrosalpinx. Diagnostic laparoscopy to assess tubal patency and treat any subtle causes of infertility like lysis of adhesion, treatment of endometriosis, etc. Types of ART. IVF. It is most commonly done. It involves ovulation induction, oocyte retrieval, and fertilization of a oocyte in laboratory. Embryos are then cultured for 3 to 5 days, followed by their transfer to the endometrial cavity. Gift. This involves ovarian stimulation, egg retrieval, followed by laparoscopically guided transfer of mixture of 2 ova and 50,000 sperms into each of the fallopian tube. The procedure came with a big bang and popularity, however, no longer is in use. Zygote intrafallopian transfer. This involves laparoscopic transfer of day 1 fertilized egg or zygotes into the fallopian tube. ICSI. This technique was developed in early 1990s. Under microscopy, one sperm is injected directly into the mature egg prior to intrauterine transfer of the fertilized egg. This method yields 50 to 70% successful fertilization rate. Indication of ICSI in male infertility are sperm count less than 5 million, decreased or absent motility of sperm, many abnormal sperms, previous failed IVF, unexplained infertility. Sperm is obtained by one of the following sources: sperm washing in a normal male, sperms retrieved by testicular sperm aspiration, percutaneous epididymal aspiration. However, a decreased number of sperms are available. With this technique, MESA, the tissue can be cryopreserved for the future cycles or future pregnancy. Cryopreservation of the embryo, oocytes and sperms, which avoids need for repeat aspiration, reduces the cost of procedure, and can be used in subsequent cycles as well as for further pregnancies. Ovum donation. Donor egg are offered to women with poor egg numbers quality or in elderly women. An egg is screened for HIV and other diseases. She is then subjected to stimulation protocol for inducing super ovulation followed by standard egg retrieval. These eggs are fertilized by sperms of the patient's male partner and the embryos transferred into patient's uterus, which has been simultaneously prepared as per the standard IVF protocol. Ovarian transplant is a possibility in future. Surrogacy, posthumous reproduction are extensions of ART procedure. However, ethical, legal, religious, social issues of these procedures need clarification and understanding. Adoption. Considering the cost of ART and the stress involved, adoption may be suitable alternative for infertile couples. Complications of IVF. Short term complications include failure. Oocyte retrieval can cause bleeding, trauma, infection, pain, pelvic abscess. Ectopic or heterotropic pregnancy, 0.4% chances. Multiple pregnancy and its complication, abortion, IUGR, OHSS, and the cost. Long term complications are premature ovarian failure, ovarian cancer due to repeated ovarian hyperstimulation, breast cancer. Surrogacy may be indicated for absent or deceased uterus, general condition of the woman precluding pregnancy.